Thank you. Ladies and gentlemen, good morning. I'm very happy to be here, and as the president of the conference, I'd like to welcome all of you to this meeting. I'm impressed from the number of people. I know that there are other people in the other rooms, and there are other people that are listening to us on web streaming, and I'm very, very happy. Anyway, my duty today is to tell you our experience about post-surgical strategy, and I'd like to start with the definition of strategy. And by definition, a strategy is a plan of action to achieve a vision. And I like very much this definition, because it's simple, and in other words, tell us that we need a vision to plan a strategy. And Bert Mandelbaum, my friend and my teacher here, taught me many times, it's very important to have a vision. So the priority is to have a vision. Without vision, you cannot have a strategy. And so for this reason, I organized my presentation in 3 different parts. Our vision, the strategy to achieve the vision, and our goal for the future. To explain to you our vision, I would like to start with a short video that you have already seen. I didn't know. Usually show you the same video. It's from the game England versus Sweden in the FIFA World Cup 2006, and it was the injury of Michael Owen. I think that both of us selected this video because you can really feel the pain of the patient. You can really understand how bad is this situation. This is an ACL injury with a normal movement. Have you seen? Just a normal movement, but he broke his ACL. And so you have a question for all of you. What is our personal feeling in this kind of situation? Try to think inside yourself, which is your personal feeling. I think that the most of us would like to fix the knee as well and as soon as possible. And this is normal. We are doctors. We are part of the medical staff. We are physical therapists. So our focus is just on the lesion. We would like to make the diagnosis and to plan the surgery because we like to help the patient. This is normal. But the situation is much more difficult because after the injury, you have the time for the diagnosis and surgery, but then there is the post-surgical management, the recovery of activity of daily living, the strengthening phase, the fitness reconditioning, the sports skill restoration, the re-injury prevention. And only when you finish all of this long process, you can really say, okay, I arrive at the recovery of the patient. And we should have the complete control of this process. And the most of the time, we didn't. The most of the time, we didn't. Because we have a perfect control of the first phases. We have a pretty good control of the strengthening phase. But we have an insufficient control of the last phases. And I'm speaking about all the people in this auditorium. The football medicine community, the most of the time, doesn't control well the last part of rehab. And so I think that it's like when you climb a mountain, and you cannot have just a good control of the beginning, a pretty good control of the second part, and you lost control in the last part, close to the summit, where it's more dangerous. For this reason, I think that we should in some way change the paradigm. We should move from the focus on the lesion, that we are used to do, from the focus on the recovery. I know that it's strange, because we are doctors, we are not an athletic trainer, but we should think in this way. We should think about the end. For this reason, our vision is that a sport medicine team should control the patient from the time of the injury to the official return to play. We want to get the top together with the patient. This is our goal. So which is the strategy that I propose to you to achieve this vision? The strategy covers the facility issue, the team, and the method, all of the 3 together. Regarding the facility, in order to complete the process of a football player, and we are speaking about football player because this is a football conference, football medicine conference. We need the medical offices, we need the rehab gym, we need the rehab pools, and we need football fields. It doesn't matter if you don't have it in the same venue like us, but it's important to control the process. And you need to have the right team, and at least, you must have 3 persons. You must have the sports medicine doctor, the physiotherapist, and the conditioning specialist or athletic trainer, the last of the chain. And you must have also a method. And the first thing about the method is that the method should share by the team. It doesn't matter which kind of method, but if the team disagree about the method, no way to get a good result. And many discussion is your fault, is my fault, is my responsibility, is your responsibility. So the method should share by the team. And it's very important, the communication model. And it's very difficult to have a communication model. It needs years and years. For this reason, we think that the crucial role is the role of the case manager. And the case manager in our method, in our strategy, is a sports medicine doctor that is really in charge for the process. He has the responsibility. He signs the clinical chart. And what does it mean? That he has to control the process from the beginning to the end. He has to communicate regularly with the surgeon. He has to coordinate the team around the patient. And he has to plan the customized treatment project. So in my opinion, he's like a conductor. He's like an orchestra director. He has to deal with the first violin, maybe the surgeon, and with all the other musicians in order to get the best music for the patient. And we started with this kind of strategy in 1987. So we have 25 years of experience. This year will be our silver jubilee. And we have 7 clinics in Italy that are working with this kind of strategy. And to give you an idea about the numbers, last year in 2011, we treated we recorded the data of 575 athletes with knee surgery. 173 of them were football players, and 21 were professional footballers. And for each of them, we look for the best biological healing and functional recovery. And I want to tell you something about these 2 points. Regarding the biological healing, we know since 30 years ago that is a long process from the Clancy study of 30 years ago on the Macacus rhesus. And also from other animal study, we know that there is a need for stimuli in the healing process. So it's very important to give stimuli during the process. And from a recent study from my friend from Ghent, we know that there is no agreement on the time frame. So we are not to think that we need 1 year, we need 6 months. There is no real agreement about this. And regarding the functional recovery, we know that the accelerated protocols allows faster return to sport. And every time that I project this slide, I have to thank you, Dr. Shelburne. We know that one athlete was able to play a first division game 77 days after ACL reconstruction. It was unique, but it did. And we know from this very beautiful systematic review, very wide systematic review, that accelerate protocols does not lead to stability problems. So we look for the balance between the biological healing and the functional stimuli. For this reason, we don't use a protection-oriented protocol based on progression of fixed timelines. Like first month you have to do this, second month this other, and you know that this is a normal protocol. We don't use it anymore. And we move to a functional-oriented protocol, where the progression is based on objective criteria. So in order to go to the phase 1 to phase 2, you have to wait the green light. If you don't have the green light, you can go forward. And I'm very happy to tell you that in a very recent study, just 1 month ago, we know that the criterion-based rehabilitation progression is a current concept for ACL. And this is a study from Adams, and it was published on the last issue of JOSPT. And Adams is from University of Delaware University. And the director of this department is my very good friend, Lynn Snyder-Mackerel. And she will speak from this podium this afternoon. And she is one of my teachers in my life. And I thank you, Air, like I thank Donald Sherburne. And after presenting you my teacher, I'd like to present you one of my patients. His name is Federico, and we asked him to help to prepare a video for you, a short video, to give you a dynamic idea of our strategy. Case manager, diagnosis, surgery, treatment plan, introduction to the physical therapist, communication, introduction to the swimming pool physical therapist, recovery of activity of daily living, rehab in the gym, rehab in the pool, and you should play in some way with the patient. Isokinetic test, aerobic and anaerobic threshold test, the introduction to the athletic trainer, and finally the on-field rehabilitation that we should control. The use of sand, the communication between the two, and the prevention, the 11+ exercises. At the end, the tackle, because the patient should trust the knee as before. Okay, now for me it's time to tell you our goal for the future. And it is very easy for me to tell you this, because our goal is to share our experience with the football medicine community. And the reason because I am so happy today is this. We have people here from 60 different countries. And for me, it's an honor. I'm very happy, and I really want to thank you, all of you, for this. And in the past few years, I travel a lot. And I travel a lot because I started work on a specific issue, the new frontier, the cartilage lesion. And with this travel, I had the opportunity to publish many papers. But I don't want to tell you about the papers. I want to tell you something that I like very much about the paper, that we undertook these studies with friends and colleagues from other countries. So we didn't do alone by ourselves, by our group. But we did it with friends from the United States, England, and many other countries. And it's wonderful when you can work in this way. So this is my invitation for the youngest among you to try to be in contact and to do something together, because it's a wonderful experience. And if you are interested in this topic and you want to have this open and international vision, I invite all of you to participate to the next World Congress of International Cardiothoracic Society, and it's in Montreal next May. Now I have in closing to give you the take-home messages, and I have 3 simple pieces of advice to follow in your practice. Reach the top, work as a team, and communicate with the world. Thank you very much.